Good afternoon and welcome to PAHO's Facebook Live. I'm Silvana Luciani. I'm an advisor in cancer prevention and control here at the Pan American Health Organization, and we're here to talk about cancer today to commemorate World Cancer Day, which is celebrated every year on the 4th of February. PAHO is really pleased to join this global campaign to help raise awareness about cancer. And at PAHO, we've taken cancer as a very serious public health issue. We're working very closely with governments and ministries of health throughout Latin America and the Caribbean to help improve services and programs to better prevent and control cancer. And some of the cancers that are most common that occur in our region are lung cancer and prostate cancer and colorectal cancer in men, and in women, breast and cervical cancer. But today we're not here to talk about the common adult cancers. We're talking about a very unique situation, and that's when cancer occurs in children and adolescents. This is a very devastating disease no matter what population it hits, but particularly when it hits children and adolescents. And so we have invited to PAHO a group of experts to talk to us about childhood cancer and help solve some of the problems and help reduce mortality caused by this devastating disease. So I'm joined here by my colleagues, Dr. Avram Denburg from the Hospital of Sick Children in Toronto, and Professor Tezer Kutluk, who's the immediate past president of the UICC, which is the Global Cancer Campaign, the Global Cancer Organization leading the World Cancer Day campaign. So welcome and thank you for joining us on PAHO's Facebook Live.
Thank you.
So for our friends on Facebook, Dr. Denburg, can you please tell us a little bit about what types of cancers are common in children?
Sure, gladly, and thank you so much to PAHO for hosting this, and to all of you out there who are listening, and for whom this is such an important issue, no doubt. Cancer in children is a very different experience and entity than in adults, as you've noted, Silvana. Children get different cancers than adults do, and by and large, we don't understand why children get cancer. In many adult cancers, there are specific causes, smoking, certain environmental exposures that we know fairly well now through lots of evidence lead to cancer. Not so in children. The vast majority of childhood cancers, with a small few exceptions, are bad luck essentially, and we don't fully understand why children develop them. Some of the most common cancers in children would include leukemias and lymphomas, so cancers of the blood and immune system, brain tumors, and then a host of solid tumors that are less common in distinct groups, but in aggregate make up a big burden of disease as well.
Yeah, thank you. And Professor Tezer, you've traveled the world as an ambassador for UICC, the Global Cancer Organization, and you've seen cancer in children in different parts of the world. What differences are there in the patterns of cancer in different countries around the world?
When you look at the distribution of the childhood cancer around the world, there are not that much differences on the incidence and the occurrences of the childhood cancer around the world. I think one major difference around the world is the disparities, because access to care, early diagnosis, treatment success is one big thing at the global level. This is why UICC and many other organizations are focusing on the curability of the childhood cancer. At the moment, the curability of the childhood cancer is about 85% if the child is able to have the right access at the right time to the right places. Otherwise, you may find places where childhood cancer cure rate is as low as 10%, 15%.
Yeah, no, that's a devastating difference in outcomes depending on where the child lives. And so, Dr. Denburg, I'm curious from your perspective as working at the Hospital for Sick Children, treating kids in Canada, but also traveling to the developing countries to help talk about how to reduce some of these disparities. What are some of the strategies that you recommend and that you suggest to help improve childhood cancer outcomes in developing countries?
That's a really difficult question, Silvana, and a complex one. I want to hit home what Tezer has said. Childhood cancer is a curable disease by and large. For the vast majority of childhood cancer types, we have effective chemotherapy regimens, effective surgical approaches, effective radiation approaches that will work to treat the cancer, and the child can be cured and live a long and fruitful and healthy life. So that is something that makes childhood cancer profoundly unique and very different than adult cancers. Children have the opportunity to live for many, many years after their cancer diagnosis and treatment. But Tezer pointed out that gap between resource settings from high income to low income. And that gap can be as big as 60–70%. We talk about percentages, which doesn't capture the human side of this. These are children whose lives could be saved who are not being saved. So the answer of how to improve those outcomes in low and middle income countries is complex. One approach to that has predominated, that has been a big push over the last couple of decades, has been twinning partnerships, where a high-income country like Toronto Sick Kids or like a St. Jude or a Boston Children's or many others will partner with a specific low or middle-income country health system partner, and that's usually a hospital, to work doggedly to improve systems of care in the institution for treating kids with cancer. So that's everything from getting the right drugs there to making sure they're standardized and appropriate treatment protocols for children with cancer, to making sure the right human resources are there, pediatric oncologists who are trained in treating kids with cancer, nurses who are trained, pharmacists who are trained, etc. So that's been a big push. Increasingly what we're realizing is that that is necessary but not sufficient. So it's very important to have that kind of institutional level support, but there are elements of the health system that aren't sort of dealt with in those kinds of approaches that really need a bit of broader based thinking in order to overcome them and to effectively make systems more responsive for children with cancer. One example of that might be the procurement of medicines and ensuring that the right drugs get to the right children at the right time of high quality.
That's critical.
Maybe I should add at this point, Avram, what has been achieved in the last 30 years in the treatment of the childhood cancer is a revolution. Because the survival rate in the 60s was about 20–25%. But it is not only because of the development on the chemotherapy, radiotherapy, surgery, and other things. It's also a matter of how we work, how we handle the issue. Working together as a team is the pushing power behind all these progress on the achievement of childhood cancer.
So health system strengthening as well as having the new medicines available. And so you spoke about the gains that have been made over the 20–30 years in reducing mortality, but are there any changes in incidence? That is, are childhood cancers increasing?
This is something we have been asked many times. I remember one study done in Europe comparing the incidences 70s, 80s, and 90s. Every 10 years, data collected from the almost all European countries shows us that every 10 years, the incidence of the childhood cancer is increasing 1%. As an incidence, it's not a big number, but when you look at the population, it's a lot of cases. That means, I don't remember any other data.
Silvana, that's actually also a complex question because probably incidence is not increasing in the sense that there are new causes of childhood cancer, but as children survive longer in many low-income countries, past the initial time of birth, past early infant diarrheal diseases or acute respiratory illnesses, beyond the HIV epidemic, they're living longer and they're getting cancer in the same sort of rates and in the same ways that children in high-income countries would. So this is a tsunami that's coming and is already hitting and is going to hit increasingly across the world. And it's the reason that amongst non-communicable diseases, which is also, as you well know, a coming tsunami, cancer in children really needs to be attended to as a distinct problem and one in need of distinct solutions.
Well, if you're just joining us now, we're on PAHO Facebook Live talking with experts on childhood cancer. So please send us your questions via Facebook, and we'll be happy to answer any questions you have. So we know that childhood cancer cannot be prevented because the causes are largely unknown. But are there strategies that can be used to detect it at earlier stages when it's more treatable, more curable? Dr. Denburg,
sure.
Let's start with you and then we'll ask Professor Tim.
So that's a terrific question. One of the biggest issues, as you imply in your question, for many children in low and middle income country contexts is late presentation. So while we can't do anything to prevent a child contracting cancer, certainly we can work to change outcomes for the better by diagnosing it earlier so that it hasn't spread beyond our ability to treat it. I think the ability to capitalize on efforts already ongoing through universal health coverage movements, through health system strengthening at the primary care level, in order to make families and primary care providers aware of the symptoms of childhood cancer presentation and link those care providers with the appropriate professionals and institutions in low and middle income country settings is going to be crucial to improving outcomes. There's lots of ways to try to do that at the primary care level, but education, advocacy, and resourcing primary care are going to be big ways of moving that forward.
So again, health system strengthening.
Right.
It always comes down to that, right? Yeah.
Maybe I could add that the political priority
Yes.
is also an important issue on this on the subject.
Yes.
It's not only the early diagnosis, it's not only the access to care, but when you look at the global figures, every year we are expecting 14 million cancer cases, including all types of cancers, all ages. But when we look at the number of the children with cancer, everywhere we are expecting more than 200,000 childhood cancers, which means when you look at the big figures, childhood cancer is a small group among all cancer groups.
Yes.
In some places, in some settings, this creates a problem on setting political priorities.
Right.
This is also important for us to invest on childhood cancer at the political level and putting childhood cancer on the national agenda and also on the international agenda. Otherwise, we will lose the battles in children
Yes.
cancer, which is curable 85%.
Yes.
Just to add to that, Silvana, I think one of the things that compounds that lack of political attention is the perception, first of all, that cancer is not a problem. Cancer in children is not a problem in low and middle income countries, which is untrue. That it's not treatable in low and middle income country settings, and therefore shouldn't be a priority, and that it's not cost effective to treat. In other words, that it's too expensive to treat, and therefore shouldn't be a priority in low and middle income country settings. And as we're at the early stages of this, but as we begin to generate more evidence on how much it costs to treat childhood cancer and what the benefits of that are, and so what the cost effectiveness of that is, we're demonstrating that in fact, compared to many other interventions that are already ongoing in low and middle income country contexts, it's hugely cost effective. And the reason for that is simple. Children are cured and they live long and healthy lives.
And it doesn't cost a lot to save that life.
That's right.
Yeah. So we're celebrating World Cancer Day, and the slogan for this year is "We Can, I Can." It's a very empowering, very proactive, take action kind of message. So I'd like to ask you, as experts in pediatric oncology, what are the messages that you'd like to give our Facebook friends about "We Can, I Can" to help reduce incidence and mortality from childhood cancer?
I have been involved in World Cancer Days for many years, from the beginning.
Oh, wow.
Yeah. When I was working with my colleagues, I said, what is this? How can I? Because the World Cancer Days is celebrated in all over the world, in more than 160 countries.
Wow,
so
that's
all the
fantastic.
member organizations and non-members all are adapting these slogans and words to their own language. So I had some difficulty to translate. Then I realized this is a very great slogan, very impressive. So we are using that. We can, I can, whatever the message you put after that.
Right.
Regarding the childhood cancer, we can eliminate childhood cancer as a fatal disease for the children of the world.
That's
this is
brilliant.
a very powerful message.
I like it very much.
And to add to that, I think Tezer alluded to this. One of the real strengths of childhood cancer treatment and care over the last 40, 50 years has been that, unlike many other disease states, the people working on this have worked so well together. The professionals, the parent foundations, and others have really worked collaboratively with a view to the same purpose to try to improve outcomes. Parent foundations, parent advocates, and the children themselves have been absolutely critical to those efforts. And so, as part of We Can, I Can, I think a call to the parents of children with cancer, families affected by children with cancer in whatever way, and all those other families that have children, or care about children, to continue the excellent work they're doing to advocate for children with cancer, to make noise, to rattle the bars, to work with healthcare professionals to do all they can to put this on governmental agendas is going to be absolutely critical.
Right, excellent.
As I said earlier, I think this is the power of the World Cancer Day.
Yes.
Because in most part of the world, if you go to low and middle income countries, the oncology professionals are leading the everything
Right.
on the oncology settings.
Right.
But they are very busy on what they are doing.
Right.
And the government has different priorities. So
course.
public awareness, all the other stakeholders are joining to the group by participating in this global campaign.
Right.
This
Excellent.
became a very powerful tool for us
Yeah.
and at different levels.
I like it.
Yeah.
World Cancer Day. We can eliminate childhood cancer. Well, I want to thank Ivan and all of those who are sending in questions for our experts. And Ivan's question is, can diet be a cause of childhood cancer? So Dr. Avram, would you like to take that question?
Sure. Thank you, Ivan. I wish I had a good answer for you. The answer that we have to date, based on the evidence that we've generated, is we don't know. We have not been able to identify really any environmental or lifestyle causes of childhood cancers. So we really don't have any good knowledge to say that specific dietary choices can cause cancer.
But we do know that childhood cancer has a lot of sort of different factors that lead to it: biological, genetic, environmental. I mean, it's a real mix of different things. So having to tease out which is the real cause is very difficult, unlike other cancer types. For example, cervical cancer, where there's clear evidence that it's caused by infection by human papillomavirus. And so it's much easier to prevent and treat. But with childhood cancer, because of the complexity of the disease and the causes, it's not as straightforward, unfortunately.
And we continue to look, but in the meantime, in the absence of that evidence, what I say every time I'm interacting with a family where a child has a new diagnosis of cancer, and I think this is absolutely crucial for those out there wondering about this, for families that are burdened with this, to know every time, myself, all my colleagues will say, there's absolutely nothing that you did or that your
Right.
child did
Right.
to contract this cancer. We
Right.
simply don't know what the causes are.
Right. Yeah.
So the subject is children, and when we talk about the diet also, we also have to talk about the relationship of diet and the adult cancers. Most of the adult cancer are linked in some ways with the healthy lifestyle and healthy choices.
Right.
But the children should be a target for making choices in the healthy lifestyle. So not only the pediatric cancer, but we should also invest on children to make their choices in the healthy ways.
Yeah, to keep the children healthy, promote messages of healthy eating to prevent cancer as they develop into adults. So if we have more questions, we're happy to take your questions through Facebook Live, and just send us your questions. We'll be happy to answer. What are the causes of childhood cancer? How can it be prevented? Which we, of course, know it cannot, unfortunately. What are some of the signs and symptoms that people should be aware of so that they could be suspicious of cancer and make sure that their children don't have cancer? Do you want to maybe talk about some of those signs and symptoms? I know it's hard to group them because there are so many different types of cancers in childhood cancer, but maybe some of the common signs and symptoms.
Sure. So I think one important thing to say up front and in general is that parents have a great spidey sense.
Yeah.
Right? Parents have a great sense of what is normal with their children and what isn't. And
Right.
so there are a whole variety of symptoms that are fairly vague that could be attached to a cancer diagnosis, and many of them need to be worked up over time. But if you feel that something is not right with your child, you're your child's best advocate as a parent, and you need to seek care as a result. So just very generally, some of the symptoms of common cancers would be unexplained fevers, bone pains, night sweats, bruising that's unexplained. Those can all be symptoms of blood cancers and some other cancers. And then if this is a little less vague, a little more apparent, but if there are growths on limbs or in the abdomen, sort of big masses, these are signs of sometimes how children present with cancer.
Maybe I could underline the signs and symptoms of the brain tumors, which is the second most common tumor in children. Because most of the time, not only in low and middle income settings, also in the high income settings, most of the cases are diagnosed in late period. Some cases are missed. Let's say morning sickness, vomiting, strokes, loss of strength, and strabismus, and those are the early symptoms of the brain tumors, and unexplained persistent headaches. Even in small children, I had a patient waking in the middle of the night and complaining of the headache at 3 years of age.
Wow,
so sometimes parents are, as you said, listening from the professional side. Listening the parents are very important for the professionals, carefully.
Yeah, and I think probably another message you'd want to give is that for parents to be persistent with the medical profession and to seek immediate medical attention when they suspect something is not right. So we've got another question from our viewers. Danielle, thank you for your question. How much do we really know about cancer and what research is needed? And again, we're talking about childhood cancer here specifically. So if you can comment on research in childhood cancer, that would be helpful. And we'll start with you, Dr. Denburg.
Sure. Thank you, Danielle. That's a great question. And it's a big question. We actually know quite a lot about childhood cancers. Apart from not knowing so well why they happen, we know a lot about how to tell different ones apart. We know a lot about how to treat them effectively, how they respond to medicines, how they respond to surgeries and different kinds of treatments. And we know increasingly a lot about how to organize our hospitals and our health systems in order to get good outcomes and cure as many children as possible. What we don't know as well, and what we're on the exciting cusp of, is a revolution in understanding how one individual child's cancer differs from the cancers that other children might have that look the same under the microscope at first glance. So for instance, in a given type of leukemia, what we initially thought was the same disease is now turning out, because of genetic changes in the cancer, not in the person, but just in the cancer cells, to be actually two very different diseases that might need different specific medicines to turn the cancer off. And we're at a very exciting moment in research in cancer in children and in adults, in that increasingly there are medicines being developed that target those specific changes in the cancer cell to turn the cancer off, rather than using chemotherapy that have the unfortunate side effects of also killing healthy cells.
Good point. Professor Tezer, do you want to talk about the research that's going on, some new developments going on for childhood cancer treatment?
What is known, what is not known?
Yeah.
You mean? At least we know what we know.
Yes.
We know what we don't know. Many things became more clear to us. Basically, etiology of the childhood cancer more on the genetic side, not on the environmental side, but still there are unknowns. But the knowns help us to make progress on the cure of the childhood cancer up to 85% level. But we are still investing on the research. Research is so critical for all us at different levels. Research at the community level, macro level, research at the micro level, laboratory level. We even need research in the low-income countries, because less data are coming from the low-income countries. This is why we are trying to encourage people from the low and middle-income countries. When we get more data from all over the world, we would be able to make more progress on the cancer. Otherwise, things are going on the right direction. We know it, but when the cure rates come to a level of the 85%, you reach to a plateau, then you are expecting less progress during the next 10, 20 years. But it might be different than what we expect. If we get more data from different parts of the world at different level, macro level, micro level.
Yeah. So we have another question that came in about the community, and how can the community provide support to families who have a child who's just newly been diagnosed with cancer? Or how can the community help advocate for investing more in health systems and services to improve those services to provide better care for children with cancer? So I turn to our experts to provide some advice on what community-level action from community groups can take place to help address childhood cancer. Tezer, let's start with you.
Yeah, I can start. I think the classical approach for many years, it was only the oncology professionals. Even the governments was not involved that much in early years. But during the recent years, we are having more progress on getting people at the community level. I think community is very critical because it's the people who are suffering from this disease.
Right.
Without
Exactly.
their involvement. How can we make progress?
Right.
Setting the priority, getting resources.
Yes.
I mean, if we are expecting resources only from the government side, of course we will make progress, but that will not be in a level that we are expecting.
Right.
If we get more community involvement, if we get more resource funding,
Yes.
and getting them on decision-making process,
Yeah.
deciding together, working together, that would definitely make a big difference.
Right.
We, during the last, maybe I would say, 10 years, we saw the power of the working together, and the community involvement is much important
Yeah.
than it has ever been.
Yeah.
You know, Silvana, I have to say, to add to that, I agree with everything Tezer has said. I've been continually bowled over when involved with children with cancer and their families at how their communities rally around them. It's one of the most moving things I've ever seen. You have people that might not have been fully engaged as neighbors, as community members,
Right.
come out of the woodwork and really surround families with love and care. And that sort of thing happens at the personal level, but I think that energy is there for those sorts of things to happen at the political level as well. So what I would encourage people to do, in addition to the love you might give to people you know who are affected by cancer, is to find out where the parent and family advocacy organizations are in your country context. Support them, act in solidarity with them, regardless of whether or not your child has had cancer or someone you know has had cancer, to really move this to a higher place on the political agenda.
Excellent. Excellent.
Changing the beliefs and behaviors is cancer is still taboo in most
Yes,
part
it
of
is.
the
It's
world.
true.
Changing the stigma is also very critical
Yeah.
from the community side.
Yeah. Yeah. Well, I'd like to thank you both for joining me on PAHO Facebook Live and talking to our audience about childhood cancer and in commemoration of World Cancer Day. And we want to leave you all with that very positive message of we can eliminate childhood cancer. So goodbye, and thank you very much for joining us. Bye.
Bye.
Bye-bye.
Muy bien. Gracias.